Hi everyone, I'm Dr. Jenny here with Pro Chiropractic, and again I'm shooting a quick video just to explain one of the techniques and treatments that we're bringing to Bozeman and Belgrade into the Gallatin Valley called FAKTR flossing. Now FAKTR stands for Functional and Kinetic Treatment and Rehab, and one thing that is a part of FAKTR is called FAKTR flossing. And what we're going to do is it's used for joint compression and helping with blood restriction, and helps kind of get that mobility back in the joint. And so I'm just going to demonstrate a little bit about how we use it here in the office. So one thing with ankle injuries, it's a really great technique to help with, again, that compression, getting inflammation and any extra fluid out of that ankle, while also working on mobility. Now it can be used more than just for ankle injuries, but it's a really great tool that we've used that can help with compressing and also, again, restoring that healing in that tissue to help flush that out and get new blood back into the body. So what we're going to do here is I'm going to have you point your toes towards yourself here, and it's going to look similar to those who know what ankle tapes look like, but we're going to start distally and we're going to move our way proximally, okay? And it's going to feel like quite a bit of compression in that ankle because, again, we're moving that fluid and that inflammation out of that ankle region, okay, and we're moving it up so it can go back into the body, and the body can help to reheal and recycle that through. So by compressing it, again, we're moving the extra inflammation, we're moving the extra, what you'd say, macrophages that clean up the injured tissue out of the area, so new blood and new tissue healing can come to the area. So it's going to feel quite a bit of compression. Lost it there for a second, but here we're going to go through and I'm going to tuck it back in here. And one thing with this is I can help get some passive motion into there where I'm moving it without the patient moving. Again, helping with kind of that beginning stages of an ankle injury or ankle issue, mobility in there. I can help get a distraction and an ankle adjustment in there, helping get that talus to move where we need it to go. Another thing we can do as we progress with the patient too is having them go through and go into a lunge, and again helping with that active, come back up, active range of motion, again with that mobility, and back down. Okay, and now one thing I'm going to have you do next is I'm going to have you kind of stand up and you're going to go on one foot, and again we can also add, part of FAKTR would be some laser treatment and biofeedback into the body, which we might shoot another video on that, but we can put that onto the knee, a laser, we can put it onto around the waist, and helping with the grid that we have here, and helping to the body to have a biofeedback along with that ankle compression. And so helping to balance, helping the mechanoreceptors in there to understand what's going on with the ankle. Okay, and then go back down, and then also go back into a lunge again here. Don't let that knee cross the toe, and come back up. And so now go back down to the chair. And so we're going to leave that on for no more than a minute to a little bit after that, and I'm going to have you spread this out, and we're going to take it off really fast. And so again, helping with letting that new tissue come back into the ankle, helping with mobility. How's that feel? Great, really great. Yep, and you can see mobility in there, really easy, so that ankle can get to dorsiflexion. If we aren't able to have the proper mobility and dorsiflexion into our ankle, that again can affect not just ankle, but knee and hip. So if you have any other questions about FAKTR flossing, let me know. Again, Dr. Jenny with Pro Chiropractic, always here to help.